My name is Siviwe Gwarube. I'm a member of Parliament serving on the health portfolio in South Africa. We are currently attending the SADC PF Assembly in Namibia, which under the theme of advancing universal health care on the SADC region. My expectations are really to try and gain a lot of understanding and parallels between what we are currently doing in South Africa and what other member states are doing in the SADC region. When we talk about representation, particularly of younger public representatives, probably the average age of the politicians in this room is probably over 50 years old, which is something of concern, and I think that it is something that we need to look at as African leaders on the continent, that the face of African leadership cannot simply remain the same over decades. We need to demand that, as we gather here in these assemblies and in the symposiums, that we demand that it starts to change and we start to diversify. We need to see a lot more young women. We need to see a lot more young people in this room, because ultimately when we are considering solutions pertaining to issues that African countries are facing, we need as many diverse voices around the table. We need queer bodies around the table. We need young women, we need rural women, we need urban women. And so it truly is my hope and my dream that over the years this assembly may transform, but currently it's slightly disappointing that a lot of the member states and the representatives that have been sent are significantly much older than I think the average population in their countries. And so hopefully this is something that can also be placed on the agenda going forward.